A person's risk of having a stroke doubles every 10 years after age 55. But a surprising number, about 1 in 7 strokes, happen to people age 15 to 49. And oftentimes what caused the stroke is a mystery. Well, that's what happened to a mother of 3 from Kennebunk. And as News Center Maine's Vivian Lee reports, she wants others like her to know the warning signs.
Celina McMichael was living in North Carolina with her future husband Jason when strange things started happening to her body.
And then I started to lose vision and the ability to talk as well.
She also lost feeling in her hand and lost her balance several times, but the symptoms went away. Just 19 at the time, she thought it was a migraine. A month later, another episode, but not as severe. She went to the hospital for a battery of tests, including an MRI and a CAT scan, which found a spot on her brain. But everything else was normal. Celina, who had a very active lifestyle as an avid runner, had no more incidents until her 30s. This time, the tingling and numbness came back in her face, tongue, and hand.
It really scared me because I knew right away that was the exact same pattern that I had felt when I was 19.
Her vital signs came back normal. Then another episode a few years later. She lost her speech in mid-sentence and the use of her hand, but again, the symptoms eventually went away. Doctors only found a small hole in her heart, but it wasn't considered a recurrent risk factor for a stroke.
I've been told migraines. I've also had doctors say anxiety.
Fast forward to just after her 40th birthday. The mother of 3 had a significant stroke and a turning point in her health. She completely lost control of both of her arms, experienced slurred speech, and the left side of her face began to droop. She was finally diagnosed with having recurring cryptogenic strokes.
Even with a very exhaustive search, we don't find a reason for stroke. And in those patients, we assume there's factors that we don't yet know about.
Dr. Jane Morris is a neurologist who specializes in treating strokes at Maine Medical Center. She says in most instances, a stroke is caused by a blood clot that blocks blood flow to the brain. But in some cases, even with testing, there is no known cause. According to the American Stroke Association, 1/3 of all strokes in this country are cryptogenic. Dr. Morris says any sudden change of motor control strength, loss of vision, and comprehension could be signs of a stroke.
Anything you suddenly lose the function of, that can be a sign of a stroke. It's not necessarily a stroke, but it can be a stroke. So we recommend you get to an emergency department right away.
In 2021, Celina did have another significant stroke on a snowboarding trip with her family, but she fully recovered and is now on medication. Celina is putting her distance running experience to work as a member of Teddy's team, which will participate in next year's Boston Marathon. Teddy Bruschi, a former linebacker for the New England Patriots, suffered a stroke shortly after winning his 3rd Super Bowl. She is raising money to help the nonprofit increase stroke awareness, support survivors, and invest in treatment and research. She hopes her journey to getting the right diagnosis will help others not to delay in getting treatment quickly. In Kennebunk, Vivian Lee, News Center, Maine.
And you'll find much more about cryptogenic strokes and about Teddy's team on our website and mobile app.